Hi, I'm Dr. William Davis, author of the Wheat Belly and Undoctored books. Here are 10 easy strategies to implement that dramatically reduce or even eliminate your risk for heart disease. Heart disease remains the #1 killer of both men and women in the country, despite all the hype we hear and all the advice we hear, like cut your fat, move more, eat less, all that sort of thing. You won't hear those kinds of messages from me. I'm going to give you the strategies that really work. I use these in thousands of people. We regressed coronary disease in numerous people. I started as an interventional cardiologist. That is, somebody puts in stents and aborts heart attacks and did balloon angioplasty, all those things. And I did a lot of them every single day for many years. That need came to a grinding halt. Virtually nobody needed them. The non-compliant people who tended to smoke and all that sort of thing, they did. But the people who followed this basic menu of simple strategies didn't need stents, didn't have heart attacks, didn't have angina chest pains, didn't need bypass surgery. With rare exceptions, everybody's heart disease came to a halt. So these are the strategies I use to put a stop to heart disease. Number 1, no wheat, no grains, and limit your net carbs to 15 grams per meal. Why does that work? Well, the science is clear. This is not my wild speculation, that those foods, wheat, grains, and sugars, cause the formation of small LDL particles. They're unusual. Those small LDL particles are very unusual because they last 5 to 7 days rather than the 24 hours or so of large, benign LDL particles. Small LDL particles are very inflammation provoking, very oxidation prone. So they're perfectly made to cause heart disease. What causes small LDL particles? Wheat, grains, and sugars. So we cut them out and you have dramatic reductions in measures of small LDL particles. Number 2, do not limit fats. Do not limit saturated fats. Eliminate the seed oils, like sunflower seeds, safflower seeds, soybean oil. But do not limit saturated fat, omega-3 fats, whether it's EPA DHA or linolenic acid. Go light in your vegetable oils, but don't limit butter. Go more coconut oils. So don't limit your oils, because limiting oils cause you to indulge in other things that are unhealthy, particularly grains and sugars. Number 3, get your vitamin D in order. A huge and powerful factor in correcting so many metabolic distortions unique to modern people. It raises HDL, reduces triglycerides, reduces insulin resistance, increases bone density. So many wonderful things, including having anti-inflammatory effects in your coronary arteries. So get your vitamin D in order. What we do is aim for a 25-hydroxy vitamin D level of 60 to 70 nanograms per milliliter. Number 4, fish oil. Fish oil by itself is not real powerful, but on the background of all these other things, it takes on importance. One of the most important effects of fish oil, or the omega-3 fatty acids, EPA and DHA, only obtainable from fish oil, by the way, is that it subdues the after-meal or postprandial flood of lipoproteins. That's what a lot of heart disease is caused. That's why sudden cardiac death often occurs after dinner. So fish oil, EPA and DHA, cut that way down, subdues the flood of lipoprotein, accelerates the clearance of those particles. Number 5, supplement magnesium. We all start deficient because our water is filtered and all the magnesium is removed. And that makes the heart rhythm unstable, makes blood sugar, blood pressure unstable. So get your magnesium. Our favorite preparation is magnesium water. You'll find those recipes in all my books, Undoctored blog, Wheat Belly blog, everywhere. 6, supplement iodine and get your thyroid in order. That's a whole conversation of its own. You'll find full conversations in my blogs, in the Wheat Belly Total Health book, Wheat Belly 10-Day Green Detox book, Undoctored books, how to get your thyroid optimized, okay? It starts with iodine, but then there's other steps to take, because the thyroid is the most commonly disrupted endocrine gland. 7, get your bowel flora in order. We take a very orderly stepwise program to do that. We eliminate disruptors of bowel flora, like chlorinated water, and herbicide, pesticide residues in food, and certain prescription drugs. We start with a multi-species, high-potency probiotic, frequent fermented foods, and then prebiotic fibers. And then we address some of the more complex issues in bowel flora, should they arise. 8, get a CT heart scan, particularly if you're a male 40 and over, female 50 and over, or even earlier in life if you have some reason to believe you're at high risk, like you smoked for many years, or maybe your mom had a heart attack at age 47, get it before age 50 for a woman, okay? So those are soft cutoffs, age 40 and 50, men and women. Just factor in your profile of risk. but get a scan, know what your score is, and then track it over time, okay? So that you know whether your program is working to stop progression. If you do nothing, the score, the heart scan score, rises 25% per year. What happens if you cut your fat, low-fat diet, take aspirin, Lipitor or other statin drug? What happens to your heart scan score? How fast does it go up? 25% per year. Zero effect on the rate of progression of your heart scan score. That does not work. Do these strategies instead. You'll see dramatic effects in the vast majority of you. Number 9, do not rely on cholesterol testing and do not submit to statin drugs. They're silly. They hardly have any effect whatsoever in the vast majority of people. Instead, get the more advanced real testing, like NMR lipoproteins. I'll list down below the starting labs that I use, to assess your baseline cardiovascular risk and track over time to see if you've affected improvements. Lastly, exercise, but not to control weight, because exercise is really a lousy way to manage weight. Exercise to do such things as improve insulin sensitivity, okay? And improve sleep, improve mood and emotions, and prevent dementia. That's why you exercise. So, and make exercise fun. Don't walk a treadmill for 30 minutes if you hate it. Don't do that. Find something you love to do, something that makes you pop out of bed and say, yay, it's Wednesday morning, it's my Samba day, or Samba lessons, or whatever you find fun and challenging and makes you get up in the morning and look forward to it, okay? Those are 10 things you can do to dramatically reduce, even eliminate your cardiovascular risk without such silly things as cutting fat, taking statin drugs, move more, eat less, all that nonsense that does not work. It's that conventional advice that keeps heart disease as the #1 killer of Americans and does not work. It keeps hospitals and my colleagues very busy, making a lot of money. So if you do the conventional path, you'll get conventional results. Do the unconventional that is backed up in plenty of science, and you shall get unconventional and, I think, superior results.